Hi, ma'am. I'm your nurse today. My name's Dakota, and I'm going to go over everything you need to know before going home for both you and your baby, okay? I see that we had a vaginal delivery with a second-degree laceration. We have a full term baby boy, 7 pounds and 6 ounces. So you have a normal vaginal delivery. And yeah, so let's go over some of the things that you need to know before going home with baby, okay? So we have something called lochia. So you'll have vaginal bleeding called lochia, which is red, then goes into pink, and then whitish over weeks. You need to report if there's any heavy bleeding, soaking the pad within an hour, large clots, and a foul smell, okay? Second, perineal care for where the laceration was since you had a tear. Use a peri bottle after using the bathroom, wipe front to back, and then ice packs for the first 24 hours, and then do sitz baths after, okay? And we'll teach you how to do a sitz bath before you leave. For the pain management, you have your ibuprofen 600 milligrams every 6 hours as needed. Use ice packs again, and then just rest. For infection signs, so fever greater than 100.4 degrees Fahrenheit, foul discharge, increased pain and redness, and that's for your infection signs. As far as activity goes, no heavy lifting greater than 10 to 15 pounds, no sex or tampons for 6 weeks, and gradually increase activity. And then for for postpartum depression, mood swings are normal. Seek help if the sadness lasts greater than 2 weeks and if you have any thoughts of harm. Excuse me. And then follow up with your OB visit in 6 weeks, and then earlier if you have any complications with your baby. Now we'll have some teaching for you and baby, okay? Excuse me. So for feeding, we're going to breastfeed every 2 to 3 hours, or do the formula every 3 to 4 hours. And then the baby's output, baby should have 6 to 8 wet diapers a day, and there'll be several stools daily. Now, umbilical cord care. We're going to keep the umbilical cord area dry. It'll fall off in about 1 to 2 weeks, and no submerging in bath. And then safe sleep for baby. Baby needs to be on back only, no blankets, pillows, or toys surrounding baby while they sleep. And then they need to be on a firm mattress. Normal temp for baby is 97.7 to 99.5 degrees Fahrenheit. You can do rectal temp check if needed to really make sure of the baby's temp. Jaundice, yellow skin and eyes. If you see jaundice on baby with yellow skin or eyes, you need to call a provider. And then when to seek help for baby immediately: poor feeding, fever greater than 100.4 degrees Fahrenheit, lethargy, and breathing issues, okay? Now we're going to go over a little bit of some medication teaching for you, Mom. So you have your ibuprofen, which is 600 milligrams by mouth every 6 hours as needed for pain relief. And you'll want to take that with food because ibuprofen can be pretty strong on the stomach and could possibly cause stomach ulcers if you take too much and don't eat with it. So it can cause issues with your stomach. And then with the DocuSate sodium, you have 100 milligrams by mouth daily, and this is to help you prevent constipation because we don't want you to be constipated and pushing during bowel movements, since you had a perianal tear down there. So it's just to help you be able to pass stool more easily. And do you have any questions? You're doing great, and we're here if you need anything.